recording. Is
All right, I'm going to call this meeting to order. The time is 6 o'clock. I'd like to welcome our guests and also let everyone know that Mr. Armstrong and Ms. Velkamp will be online with us tonight. For the agenda today, the motion is that the agenda for the council meeting of November 18, 2024 be approved as amended. If we can remove item 12.4 because Mr. Armstrong's not here today. Is that okay with everyone?
Yep.
I need a mover and a seconder, please. Moved by Councillor Kirkby, seconded by Deputy Mayor Burton. Is it switched over now?
it is switched over?
Oh, there we go. All in favor? Thank you. Any declaration of interest tonight? Seeing none, we're going to move on. So number 4 is presentations. We have Sherry Fournier Hudson and George Smitherman here from Health Workforce Innovations Incorporated. They're going to talk about their latest project with the counties and hoping to include the joint services single tier municipalities on physician. So the floor is yours.
Thank you.
Yeah.
Yeah, sure. You stand behind here?
Stand wherever you like. Yep. Sure.
On over here, Sherry. Give us a little bit on rooms work here. Firstly, your worship, members of council, thank you for the opportunity to present, for the privilege of being here, and also for me, at least for the first time, to experience this beautiful building. And the repurposing of heritage buildings is something that I really, really treasure, and it's just amazing, the spaces that you've created. So congratulations on that. I was looking at the crest of Prescott as I was sitting there, and it said industry and commerce and light. And in a certain sense, though our item might be contemplated as kind of a health or social services issue, the reason that Sherry and I came together with a view towards trying to create in Leeds and Grenville an approach to health, human resources, and physician recruitment stemmed from concerns that were brought forward, especially to Sherry as a longtime local, from leaders of industry, captains of industry in the area that were suffering with the challenge of trying to recruit human resources for their facilities or what have you, and struggling against a backdrop where frequently they couldn't give a good answer to the question, can I get a doctor? And so really that's the rallying cry that brought us together. We've been having, since the summer, a series of meetings with a view towards trying to get all 13 of the municipalities in Leeds and Grenville aligned towards an approach that, in our way, we like to say it would create a destination here in Leeds and Grenville for healthcare workers to rally up the many fantastic amenities, natural and otherwise, that are attendant in all of the communities, and really try to create what we describe as a destination effect. That is to say, to create the environments where people want to practice. It's going to be increasingly competitive. And I think you can see from AMO meetings or Roma meetings or otherwise, you hear what other municipalities are up to and the like. Well, our view is that there's something special here, and we would like the opportunity over 3 years to really build on that and enhance the prospects of the people getting access to the health human resources that they need and when they need them. But we really do encourage municipal leaders to think of it also from the standpoint of it as an economic development initiative, a leverageable event where if we do well in this area, we reinforce the prospects of communities being successful with a lot of the other challenges that they have to have economic progress and build the tax base and all of that. So, thank you.
And I guess I'm assuming you've all read the presentation that we sent out. So we don't want to take up a lot of time repeating all of that information. So really, we'd like to open it up for questions and discussion. Unless you would like us to go over any area of that presentation that you specifically would like to cover. Otherwise, we'll open it up for questions.
I guess one question would be, how, you know, if we're working for all of Leeds and Grenville, how does it benefit us? That's going to be a selfish question, but it's a question that we have to ask for this council.
What we're trying to create, Your Worship, is what we describe as an all-community approach. And that in a very way, it's not just likely that how would you be benefited, but what more would be asked of you and your colleague leaders in this community to help to actually create the welcoming capacity for healthcare workers. That this is part and parcel. It's not like, there's not just one thing that you can do. Like you can't just offer people an incentive or what have you. What we feel strenuously is that the cash incentive models, which sometimes communities end up relying upon, create more likely a shorter term duration mindset. We're all about a model where we root those healthcare workers. So it might be that we have people an individual coming to work in a healthcare setting, but the spouse works in an adjacent sector, and where we actually need to make sure that they're successful as a family, or that the kid plays hockey or soccer or what have you, that they're integrated into that. So not only do I think that's what's going to ensure success, but just to be clear, like we want to build an all community model here where invariably we're going to come back and work with you and help you to identify the things that we can brag about in a certain sense for your beautiful corner of Leeds and Grenville, if it's okay to say it that way. I'm still learning the nomenclature of a Toronto person, so if I make any missteps, please do help to correct me.
Yeah, and I think it's important to recognize that I come from here. This is my home, this Leeds and Grenville. I wasn't born here. I was born in Lanark County, but I have been raised in this area and have come back to raise our children here. And I feel very strongly that we need to support all of these communities around. And I worked in healthcare for the last 15, almost 16 years, and I see all these communities that truly need like primary care physicians as an example, but not just primary care physicians. We need nurses, we need, social workers, we need pharmacists, we need techs for our hospital. There's a multitude of things that we need for healthcare. It's not just, a couple things. This is more than just primary care physicians. So, we're really going to have to work with the communities, and we hope to, as I think we've talked about before, but establish that steering committee that will involve, people like yourselves around the table. We really want to, it's an all community approach. And we really, when we meet with the ministry, both ministries actually, Ministry of Immigration and also the Ministry of Health, we've used that term rooting. And it's a term that really hasn't been used very often, because everyone's talking about recruitment, but no one's ever talking about bringing these people into their communities and making sure that they're rooted and that they are welcomed into the communities. And, George uses the analysis many times as, the Syrian refugees, when they came, everybody got behind that notion of helping those people get settled. Well, these physicians and healthcare providers, are going to need to be settled. They may need a home to live in for 6 months until they get their feet underneath them. So, how are we going to do those types of things, or a car to drive until they get themselves established? So those are the types of things that we will need to look at as communities within Leeds and Grenville, and Prescott is, of course, going to need to think about those things.
Just to say a couple, because your question was the essential one, just to kind of add a few elements to consider. One of those is that to be effective at leveraging healthcare resources, which are large, if you think about doctors, a doctor that arrives in town comes with a billing license. So any that we can attract has an economic development implication, also having them in the community. Same with nurses that might currently be in, agency nurses. If we can find local people to take on those jobs, which pay well over $100,000 in many cases, this is a really, really significant implication for communities. But one of the things that, if you look at what's happening, it's a very exciting time, I think, that's coming with respect to primary care models. And a lot of what motivates action on primary care models is when we have good data around unattached patients. And one of the things invariably that we're going to need to do all across Leeds and Grenville is encourage people that are not receiving adequate access to primary care to get on this list, which has existed for a long time, but not really known to be that effective. So it's just kind of a precise example of how, we would really look forward to coming back and working with all of the 13 municipalities that make up Leeds and Grenville to help to build up knowledge of who's actually out there without the connection to care that's required, because the information is here, there, but it's not all in one place. And the second thing I would just say is that what we wish to be able to do, and Sherry and I have been promoting aggressively with inside the Ontario government for new models that would allow physician attraction to occur using provincial powers like the provincial nominee program, where a local area could be involved in helping to select a physician that might be an offshore physician. And that routing process, therefore, you could imagine, would begin so much earlier. And we'd make sure that we weren't trying to fit, the round peg and the square hole in all of this, but rather that we'd done a matching job. And the other word that sometimes comes up is concierge, kind of to that point that Sherry was making with respect to the way that in the case of some of the sponsorship of those private groups came together to support Syrian refugees. It was like an all hands on deck kind of approach. Sometimes we use the word concierge to say that with respect to the prospects of having to help people with immigration matters or with settlement or what have you, that we need to be very, very integrated in making sure that those processes were successful, that at the end of the day, the local community where that routing was going to take place is more essential than ever in the model that Sherry and I contemplate to help to develop here.
Very good. Thank you. Council, any questions? Councilor Kirkby?
Just a few statements. The one thing that sticks out, we're no different than any other municipality. We're in a retention or attraction period, to ensure that we have primary care. I think the numbers I heard in town is close to 400 unattached patients. What serves us and doesn't serve us is when Brockville per se gets the new doctor that's funded by the government with all this attraction, because some of our residents don't travel. They rely on services to get there. And so a model that I've been thinking for quite a long time is a rotating facility, where so many days a week they're in this community, so many days a week they're in the next community, something that could be shared, that, feels like, to the mayor's point, that we all get something in return, and that's kind of where I think each community or municipality in our area is, outside of Brockville, which, there's a little more to attract people there at times because there's more to do per se, not that every doctor wants that, but, that's kind of when I think of primary care here, it's, I don't know if we have the power to swing a doctor here, but if we worked with other municipalities on some kind of rotating basis to offer primary care 1 or 2 days a week, on a rotating basis, that to me is a win.
Well, the model that you're proposing, like Sherry and I are very aligned with you, and you're not the only place. That's the beauty of it for us of in a certain sense being forced to service 13 if this work is given, if we're granted the opportunity to do this work, is that we really view it as there's 13 municipalities there of varying sizes, and the circumstance that you just spoke to with 400 or 500 unattached patients, that's kind of like half a doc. And to your point, maybe not enough to leverage one, but we've already seen that model even in Westport. We talked about I guess kind of almost like the kitty corner other end of the Leeds and Grenville. So there's a lot to be said for the model that you spoke to. Two other things. You mentioned the word right at the beginning, I think, facility. And Sherry and I really think actually that at the end of the day, like now Jane Philpott's going into the provincial government as a deputy minister to focus on primary care. She's been at Queen's. Probably most of us are familiar with that. She's talking about these health homes. It's got a fairly similar model to community health centers. I'm interested to see what the key differences are over time. But in a sense, I think that where it's possible to replicate the environments where a physician and a nurse practitioner or others possibly can step in and do their practice without the overheads, and where we found a way to get them networked on an electronic health record, et cetera, where we've reduced that administrative burden, which is coming up a lot for the docs, then we can make it work. So Sherry and I really are quite aligned with the idea. And I have to say, you know, like I do get I'm from downtown Toronto, okay? It's like I'm here and learning my way. And Brockville never seemed like a big place to me. But working in the context of Leeds and Grenville, I can see it's like, it has a lot of what family doctors need, because they don't want to be working in family practice and isolated from the ability to send people to a specialist or connected diagnostics. So we need those networks, but we're very local in these approaches. My answer is too long, I'm sorry, but I just got kind of passionate because we're really very, very aligned with where you're coming from.
And I have a second part to that. Is there a role that industrial players can be part of this for attraction of employees and retention of employees, right? Because I'm sure as more companies get bigger and move into the area, one of the key things is having primary healthcare for their workers.
That's not lost on us either. You raised a great point too. I think that's something that George and I have spoke about many, many times. So I think that these are all really good points. And I think that as we form steering committee and the all community approach, I think that that's a really, really good point, because I think that, you know, we can't leave anything untouched. We really need to open up all of the doors and look at all of those things, because I think they're all good points.
And philanthropy will surely be like the model that we imagine when we think about all community involves resources that will be needed here and there, and naturally finding a diverse array of support service clubs and like building that all community approach invariably also means local philanthropy will be presumably called upon to play some role in all of that. But just to remind you, like what catalyzed our meetings in the first place with the corridor group of mayors, I think your worship was there or not there for that first meeting in the middle of the summer, but it was because they have an economic development motivation, and lots of those captains in industry were the ones that were saying, hey, it's getting very tough out here to attract workers, et cetera. So we know we have a good starting interest, and of course, everybody's got those relationships, and we look forward to building on those.
Thank you.
Yeah.
Through you, Mayor Shankar. So it seems to me that we've almost sort of touched on this model before when COVID hit, and we set up in a rink here and a rink there, and the docs came out and did their spiel, and the healthcare people came out, and nurses came out of retirement to work 3 days a week here and 3 days a week. So it seems like some of the groundwork has already been done, and we can expand on it.
Well, I think Sherry Sherry was recognized by St. Lawrence College recently because of the leadership that she did in organizing those local clinics. And why I'm so proud to have teamed up with her, because we met again after like quite a lengthy period. She's been running a family health team that I was involved in helping to establish, and we were reintroduced to each other. But she has a reputation for championing healthcare kind of across the silos. And those clinics were something that she's been acknowledged for her leadership around, so they could stand as a good example. Everyone can be competitive, but on certain things, you got to be all in it together, because you're not big enough in your own right to fight it out against a wealthier municipality that's throwing their PUC profits at doctor retention or what have you. But there's a strength in number that starts to come into play with the whole of those 13 municipalities, with the embedded hospitals and the other elements all part and parcel of it.
The partnerships are key. I think, to your point, we're you can't really do anything by yourself, whether you're one municipality or you're one person or you're one organization. The key is to partner and, we'll go so much further. I truly believe that. So that's kind of my, that's been my key point throughout my career. I have strengths, I have weaknesses. And so I always try to, surround myself with people that have strengths where my weaknesses are. And I think that that's really what we need to do in Leeds and Grenville, because we have all of those strengths amongst all of us. And I think we really could build a really great system in Leeds Grenville. But it's going to take all of us to do that. And it's kind of an exciting thing to think about, really. When we met with, I'm just going to share just a little bit of the meeting that George and I had last week. We met with Dr. Belgi, who's the Assistant Deputy Minister. And you could tell she was pretty excited about a presentation that George and I gave. And it was essentially around Leeds and Grenville and a bit of a pilot that we presented to her. And so we're pretty excited about that.
One thing that can come up that is that to someone might seem as a bit Brockville centric, but is really actually a leverageable strength for everybody. And Sherry and I are really trying to do that. And local MPP also is very, very effective at kind of opening doors where needed and coming in behind. So we're quite well aligned on that, is what's described as practice ready assessment. So Ontario is running a pilot through an organization called Touchstone Institute to bring forward doctors for a quick 12-week assessment who are deemed to be more practice ready because their skill set is excellent and has been utilized without going quiet for too long of a period of time. I'm paraphrasing a little bit. Sherry and I have been focused on, and there are 50 of those practice ready assessment centers that have been established in Ontario, and one of those is in Brockville. And what we've really been trying to highlight how that can play a role also as kind of, I call it the Leeds and Grenville entry. And so as we get more into this, conversation, you'll probably see references even in that slide deck, which we distributed, to practice ready. And just keep in mind that there is a leverageable opportunity there because one of those 50 centers is already established in Brockville.
Great. Councillor McConnell?
Thank you, Mayor Shankar. You hit on one thing that's kind of elementary, I think, to the situation, and that is it's pretty tough to attract a doctor if we don't have anything to offer their spouse in the way of employment. And I've encountered that discussion with my own doctor. And that was one of the issues that you mentioned in coming in. It was difficult because there was nothing for his wife. There was a time in Prescott, the vast majority of our doctors actually lived in town or very close to town, and we haven't had that in years. Matter of fact, one of our doctors now commutes from Montreal, which is no connection to Prescott at all. But I was reading the article in the Brockville paper where you had spoken to the Mayor's Caucus and the United Counties. And while I can attest for him that just everything you read in the paper is not always true, there was a figure mentioned, and it was a substantial figure that you were looking for. And it's not the figure that I'm going to ask you to comment on tonight, but the way I read the article was it was the figure plus expenses. And I think for politicians, which essentially we are, and United County politicians from Brockville from all over the place, and our CAOs to have any reasonable discussion on this and to even consider it, we would have to know what those extra costs are. You mentioned, well, I'm going to say you mentioned, it was mentioned in the article, so if you didn't mention it, by all means say so. But you mentioned South Africa, that's not traveling to Cardinal, that's a long ways away. If you go to South Africa for a couple of weeks, I suspect we're into the tens of thousands of dollars. I'm presuming all those trips would be extra. What you need to do, I think, to convince the various councils to kick into this project is come up with a idea of what these extra expenses are going to entail and how often they're going to occur, because it's all very well to throw a figure at us, but without the total view, I couldn't make a decision on it.
So
Despite the fact
okay.
that I think it's a hell of a good idea.
So just because like Sherry and I are, if nothing at this point in our lives, like interested in complete and full transparency. So you talked about a figure, but you didn't mention it. So what's on offer is for Sherry and I to be contracted as consultants to help to provide leadership in Leeds and Grenville for the development of health human resources and physician recruitment strategies at a contracted basis of 15,000 Canadian dollars per month on a 3-year term.
Mm-hmm.
And it was hinted, at least in a couple of conversations, that there's a few different models of cost sharing in situations where where all 13 municipalities are involved. And I'm imagining for Prescott, that's somewhere between 5 and 10% of the overall number. And the CAO probably can confirm that, just only because I heard 2 of the other numbers so far. So we're just doing the simple math as we go. So in a certain sense, from the standpoint of that contract, you can imagine that for less than $1,000 a month, you have me and Sherry, like I drove here from Toronto only for the purposes of this meeting. And that's to demonstrate to you that what you gain, even before the additional piece, which your question is an excellent one, and I'll address it as best as I can, is we're going to offer a lot of value even before we incur added expenses, if I could put it that way. So we're going to get involved immediately in conducting a survey of all the healthcare providers in Leeds and Grenville to actually see where we're at, because there's knowledge here and there, but it hasn't been all brought together. Those are not things which are going to incur added expense. But recruitment of healthcare workers is an added expense activity, and there's quite a few different ways you can go at it. And it's not for Sherry and I at the starting point of a contract to impose that model. We have to figure that out with others. 2 of the 13 municipalities already have doctor incentives, and 11 don't. So part of our work, like I do get your points, like how much added expense? Well, Sherry and I won't be traveling to South Africa together, that's for sure. Like obviously all of those things do come as added expense. And part of our expectation is that that added expense would be a shared exercise, including that all community and including philanthropic groups and all of that. But really differentiate in a sense the contract request that's there is separate from the cost of recruitment, but those strategies and approaches will be developed with all of the people involved, and keeping in mind that some municipalities have already got dollars deployed and strategies that are in play, and we need to take stock of those as we go forward as well.
Thank you.
Councillor Campbell.
Through you, Mayor Shankar. Thanks for coming. I've been reading in the paper that communities now feel pitted against each other in terms of these doctor incentives. So does this model address that?
Like Sherry and I, so to be transparent and sensitive at the same time, as I just mentioned, a couple of municipalities in Leeds and Grenville are using financial incentive for the attraction of physicians. And we have to say, good on you, because they've shown leadership and they felt that's what they needed to do. And lots of communities are feeling pretty desperate, and they think that that's the stakes that have to be played. What we would like to do, and part of our proposal, is to get a college in Eastern Ontario to actually kind of rally up a bit of a spreadsheet of what everybody's up to. Because I know a little bit, I heard about Belleville, but I'm not sure about Picton, etc. It is a very competitive environment. our approach is actually not to intensify that competition on the basis of front-end financial incentive, but more on a model that is designed to try and provide support for people to be rooting. So we're trying to shape a different approach, which is to create off of the basis of the starting point you have here, which is 13 remarkable communities, excellent housing. Like, I'm from Toronto, okay, like excellent price of housing, beautiful quality of life, etc. And to create practice models where a family physician feels like, hey, that's a place I want to live there because I don't mind practicing there, because I can get diagnostics done and refer into a specialist network, and they've got a situation here where I don't have to worry about overheads or the administration, et cetera. So we really feel the potential to create a destination effect, but is kind of like a virtuous competition rather than an elbows up, we got more money than you one, which it's been told to me, Leeds and Grenville communities for the most part are not like financially set up for that.
The other thing too I would add is, like, I spent a lot of time with primary care physicians, and there's two groups, it seems. There's the younger group, and then there's the physicians that have been practicing for a long time. And when you listen to them, the younger physicians are looking for different things than the ones that have been practicing for a long time. So, the younger physicians are looking more, in some cases, I wouldn't say a salary model, but they're looking for more of a turnkey solution as opposed to the old style of, incorporated business style. And, so there's something that Leeds Grenville will maybe need to think about, where they somehow get involved in, taking over some leases. I'm just throwing things out there, but get more involved in that piece as a Leeds and Grenville model to attract physicians. There's something we need to, I guess what I'm saying is, need to think outside the box on how to approach it. And doing that as Leeds and Grenville would be an interesting concept to look at something like that. When you get everybody together and maybe some physicians, whoever's on that steering committee, however that looks, maybe you start looking at some things like that. There's lots of things that could be examined down the road if you are going at things as a group, and it would give a place for people to come and have those discussions.
Thank you. Follow up?
Through you, Mayor Shankar. So let's say Spencerville gets a doctor and Prescott doesn't. Would that doctor be able to take patients who could travel to Spencerville?
Yeah, well, it's the same now. We can't stop that now. So it's, I think that's the way it is now. So like, there's people in Prescott that, I know people in Brockville that come to Prescott and vice versa. So I would assume that would be the case.
The thing is, like, we could speculate and give you answers on practice models that we make but that's because we could give advice towards that. But all of those excellent questions, we feel we have to play a role in helping to formulate those answers with the community and with healthcare providers. In our model, we would utilize things, because I'm very focused on evening and weekend coverage, because I have a family health team in downtown Toronto and I get care. That means that on Saturday from 11 to 5, I know that there's going to be a place where if I've got a gash in my leg or whatever, I can go there, et cetera. And sort of back to Councillor Kirby's question is, like, Sherry and I, we feel like it's possible to, because, that creates an onus on docs for certain coverages in the evenings and weekends, which is sometimes a challenge, where the primary care model means you're rostered to a doc, but the access for the evenings and weekends has been spotty. And I'm not sure of the situation here. I'm pretty sure it's variable. But we really think it's a feature where we can try to actually create that practice model that works, and where on a different Saturday, maybe the clinic that people in this corner of Leeds and Grenville has to come to is the one in Prescott. And maybe on another Saturday, your folks are going to have to, because you're not going to have them open all the time. But it's just to reinforce the idea that we have, which is that all communities can be leveraged and also benefit from a well-developed practice model. And just one more thing on practice models, doctors are not a monolith. Even like in the Ontario Medical Association is divided up into literally into 42 distinct groups. But even within family practice, you find a lot of different kind of almost philosophical orientations. And that's one of the things that we have to balance here. A lot of people, like the Philpott model, they're talking about today's medical students more likely to want to practice on a salary basis. Sherry and I are like, yeah, but like, what are we going to do to enliven the 30 or 40 current practicing docs to want to stay in practice? Because it's as much, you can think about attraction of the next ones. We have to have a huge focus on retention and extension of the practicing life of as many of the doctors that we already have.
Right. So I'm just going to check here. I know Councillor McConnell would like a follow-up, but Councillor Young hasn't said anything, so I'll let Councillor Young go, and then Councillor McConnell, and anyone else.
I'm
Good?
Yep.
And we'll wrap it up after that.
Thank you, Mayor Shankar. Just wondering what timeline you're looking at for a response from the municipality.
I can answer that. So they're here today because we have a joint services meeting in December, first week of December. And at that meeting, they're going to chair the motion or the motion about, are we going to approve this or not?
We've been at, like, the thing about it is that I was going to answer and say, like, yeah, like trying to get all of those, the county with 10 and 3 others aligned. That's taught us a little bit about that joint services process as well. We've already, in a certain sense, gotten on with a fair bit of the work, but every municipality that's a signatory or a potential one needs the opportunity to feel comfortable with it and to approve it. But that timetable is the one that's kind of working through with the joint services.
Councillor McConnell?
Actually, Mayor Shankar, I'll hold my question. Honestly, I think the discussion that we need to have is amongst us. Without you both present, which is normally the way we do things. Just somebody makes a presentation, and I would suggest that this should be our next meeting if you're coming.
I'm gonna ask a question of Matthew or Lindsay. Maybe we can talk about it later on after they leave.
We'll take our leave now.
Sounds good.
Thank you very much.
Thank you.
Grateful for the time.
Thank you.
Can you just?
Thank you.
Thanks for coming. When did you say that was coming?
It's a December 4th or 3rd meeting.
That's before
That's before our next one.
our next meeting.
That would be hard.
Yeah, so that's why I had them come today. We need to, if we're gonna approve it here first, before we take it, before I go to JSC. Because they came to JSC last month, but on a procedural reasoning, we couldn't floor the motion because they hadn't come talk to all of us. And that's fair enough. So yeah.
Theo Armstrong has his hand up.
Oh, he does? Okay, Mr. Armstrong? Can you answer that question, whether we can discuss it now or discuss it in camera?
So I think certainly you can waive the rules of procedure. I think Lindsay can weigh in on it as well, but to discuss it this evening, I'm not sure it's an in-camera item, or we can bring back a report or have a discussion on the 2nd and be able to have that response ready for when the next meeting is. I think based on the information I've seen kind of going back and forth, is that it wouldn't be under JSC. It would be an agreement between the United Counties and the 3 single-tier municipalities outside of the JSC portfolio.
Okay, so we, yeah, So we, yeah.
portfolio.
Right. That's the confusing part
Mhm.
for me. But okay, so if you'd like, and it's up to council, do you want to wait and get a report and discuss it on the second, or do you want to discuss it today? We do have that time to think about it till the second, because the meeting will be the following day. JSC. Or
The two
counties, yeah.
I think
What
the
does
second
council
to
think?
gather
Second.
information, and
Okay,
Matthew would be here.
Yeah.
To answer any other questions.
okay. That sounds good. Everyone's good with that?
Yes, I think that's.
All right. Thank you. Okay, we don't have any delegations tonight, and then the next thing is council minutes from November 4th. The motion is that council minutes dated November 4th, 2024 be accepted as presented. Can I get a mover and seconder? We'll go with Councilor Young and Councilor McConnell. Any discussion on the minutes? All in favor? Carried, thank you. All right, number 7 is communications and petitions, and we do have an item, the United Counties of Leeds and Grenville letter Regional Policing Subcommittee. Was there any questions about that letter from the United Counties? Councilor Kirkby?
Through you, Mayor Shankar, this is just a recommendation. Doesn't really require our consent for this to move forward. Is that correct?
That's correct.
Does that mean that somebody from this council will be tasked on to the subcommittee?
So my understanding is, at our last joint services committee, this was brought forward by one of the mayors about having a regional policing. My opinion at that meeting was that we'll listen, but that we're very happy with our OPP representation. So that was, and I stated that publicly. So unless you guys want to change from that, I mean, you look at our last 10-year history with OPP and we're still paying less than we were paying from 10 years ago, even though we got a big increase coming this year.
Yeah, through you, Mayor Shankar. When I look at the cost of equipment, infrastructure, and then think
Capital
about,
costs.
we'll be under the same, it will only be a few years that we'll be facing the same kind of wage increases and stuff like that from a regional police force. I don't see it being something that I would be interested in. I speak for myself in that city.
Yeah, I don't see the fiscal ramifications helping us at all, but I said I'd listen to them. Councilor McConnell?
Thank you, Mayor Shankar. I read what you had to say about us being cheaper than we were before, and of course you're correct. However, are you going to wait 4 years down the road and if you're still here and say the same thing when we are maybe $100,000 less than 2 million? There is another way to look at that. And it's the way I've been looking at it, which is why I have this motion coming forward, our notice of motion, pardon me, this evening. Our original Prescott Police Department, the costs were getting out of hand. Council today decided to go with municipal police force because it's cheaper, quite frankly. And it started off at, I believe, about $1.1 million and had gotten up to, well, it was going over 2 million when the province leveled the fees in 2015. But we have been increasing that time. And you're correct, of course, we are paying less than we were, than we would have been in 2015. But the point of that whole thing was we were paying too much money. It was strangling us. And the higher that we go, and the 18% cost for this coming year, putting us closer to that position, we are going to be strangled again without significant tax increases. We've been able to do an awful lot with that $900,000 that we're not spending on police protection. So your comment that we're paying less than we are, despite the fact that it's correct, I don't think it's the proper attitude that you should be taking. You should be taking the attitude that we don't want and we shouldn't be paying as much as we are now. We don't want to get closer, any closer to that $2 million. As far as the regional police force goes, well, we went through that before, and we found that to expand the Brockville Police Department, everything had to be connected. We couldn't, Augusta was interested, we were interested, but it didn't work because Kittley and Elizabethtown, Kittley, Elizabethtown wasn't interested, and there's a gap of a few miles there. So there is that involved as well. Everybody would have to agree. And given the fact that our municipal police force was more expensive than the OPP, I don't know how a new regional municipal, if you want, police force would be less expensive. So I agree with you on that. But anyway.
Councillor McConnell? Sorry, Councillor Christie.
If I may, in our last information package, it came out and we should have, maybe somebody should have pulled this out. There is a resolution going around by the municipality of Tweed that has been supported by the Whitewater region on OPP costing, right? And the push for greater funding to rural municipalities to deal with the upswing in the cost of OPP policing. And, you know, I didn't pull it out because I'm famous for pulling out all kinds of packages, but that is one, you know, that is a glimmer of light, in my opinion, that townships and municipalities like ours are starting to take note on the cost of policing when it comes directly from the OPP, right? As you say, the only way we can pay for it is through tax, right? So just to call that out, there is some talk and traction amongst the municipalities. You know, probably should have supported it. Maybe at some point we could make our own motion to get that message to the province. Thank you.
Thank you. The province is well aware because we are not the highest by any means. There are some municipalities that are facing a 30% increase. So the provincial government is well aware of the displeasure in a lot of the municipalities, and they have told us that they are working on something. So you have that as well. Any further discussion on that communication? All right, we're going to move on to 8 is consent reports. The recommendation is that all items listed under consent reports section of the agenda be accepted as presented unless we want to take something out. Anyone want to take anything out?
If I may.
You may.
You, Mayor Shankar. I just made note of the Spirit of Giving campaign that you kicked off with the rest of the mayors. And I just wanted to highlight that the dates in Prescott for registration are November 20th, 21st, 22nd, 25th, and 26th from 1 to 3 p.m. at the Leo Boyden Community Center.
Can you just explain a little bit what you mean by registration?
Yeah, so the registration is for, I think it's pretty much open. You have to, once you appear in front of the registration committee, I believe there is some boxes to be met. But if you qualify at that point, then you would qualify for a donation from the Spirit of Giving.
I'm not sure exactly.
It is a registration process.
Okay.
Yeah.
I believe
But they
there's a
do have-
threshold that has to be met.
Okay. Yeah, that's great. So that's the dates are 20th.
Yep, so they're pretty much running in a whole week from the 20th to the 26th from 1 to 3 p.m. at the Leo Boyden Community Center.
Okay, perfect. Thanks. So then that way we're all good. So did I get a mover and seconder on that? I don't think I did. No, I didn't. Personally. Moved by Councillor Kirkby, seconded by Councillor Campbell. All in favor? Carried, thank you. Okay, no committee reports tonight. The mayor's report. I apologize that I did not introduce our new Director of Operations, Mr. Matthew Locke. We have worked with him before. He was, worked in Brockville, was head of the transit system there. And we have worked with him before, so it's a nice fit for us. I think he'll do well, and we welcome you. Thank you, sir. All right, in the last 2 weeks, so I was at JSC meeting where that was the highlight of that meeting. They are getting ready for their budget. Hopefully they got sharp pencils over there. A couple of weeks ago, we had the community paramedic program came to town. They were set up over one of the buildings down here on Water Street. And the nice thing about that is if you don't have a doctor, and that's a common theme to tonight's meeting, they come in and they have access to a helpline where they can get you what you need. So if you're needing an antibiotic or a medication, they're able to help. So it was quite an interesting meeting, because while I was there, our patients were getting helped, which was really neat to see. And they come into your community. So because of the lack and the shortage of healthcare providers, this has been a big positive influence for our area. I've had open door meetings with residents. That was last week. There was a big craft show at the golf club, well attended. I think I've seen a few of our counselors there. Remembrance Day was a very nice day. We had good weather, good crowds. I think they said 500 people or so. Maybe not our best crowd, but probably one of our better weather days. And then they had a nice little luncheon at the Legion, so that was well done. Councillor Campbell and I attended an emergency management meeting where we discussed potential scenarios and how we would handle those scenarios. So that's something that's mandated by the government to do that. I also went to Brockville for the United Counties had the starter company program. And there was a couple of, on the list, there was a couple of people that were from Prescott. So, you always want to go and support them. And then I was a guest speaker at the Rural Recreation Association. They had like a little summit, and they had strategies for aging infrastructure and purposeful reprogramming. So I talked a lot about the success of our Leo Boyden Arena, or how we've turned lemons into lemonade. So that was well done. They had over 100 people there, so it was a really nice meeting. I'm going to leave some of the other things that happened so that I'm not stealing all of it. I'm going to pass it around. So Ruth.
Can I ask you a question before we go on? You mentioned the traveling healthcare thing.
Yeah, community paramedic program.
How would people be advised that is coming? Is that a monthly thing, or I'm not aware of it?
Yeah, no, that was a first for me. I don't know if it's monthly or how often it is, but they do let people know on social media. So maybe we can reach out to them and add it to our social media.
Yeah,
so that
we can add on to that as much as possible, because it would seem to me that maybe the people that should be aware of it, that could use it, might not even know that it's available.
So I'm pretty sure the building that I met them at is one of the buildings that county owns. So it had a lot of those residents in there. So it's good for them. But yeah, we'll add that to our social media.
Great. I mean, as for Councillor McConnell, I'm a social media hound and I didn't see it anywhere. So I think more sharing would be great for our residents for sure. Thank you.
Thank you.
Good. Thank you,
Councillor
Mayor
Hawken?
Shaker. I was going to ask the same question about the paramedics. Just to tag on a little bit to what Councillor Kirkby said about the spirit of giving. It is in full swing. I know that I think all participated in the amazing Santa Claus parade, and they were doing some collections and stuff there. But we've also got the holiday cookie this year that we're doing, and it's for the spirit of giving. So our stores, 2 stores in Prescott are doing it, mainly because I don't know if any of you read the little blurb, but our son met our daughter-in-law in Mr. Courier's grade 12 class, and that's how they started off with their spirit of giving. And now they're married and blah, blah, blah. But we're doing the campaign is this year for Spirit of Giving. So, you can order ahead, you can pop into the stores and, I brought some tonight so we can sample them, so you'll know what you're getting into. So everything that you mentioned, I've attended as well, the Remembrance Day, the craft sale, so I'll pass it on to Councillor McConnell.
Thank you. I'm not gonna have too much to say tonight. I did enjoy the Christmas parade and thank the firemen for the usual great job that they do and the time that they put in. I was looking forward to having one of those Christmas cookies or Christmas donuts from Tim Hortons, but you must have ran out before you hit the main street, did you?
Oh, yeah, on the parade?
Yeah.
No, we didn't start the cookies till Monday.
She brought some for you.
I brought them tonight,
I
$1.50.
was joking.
It's for a good cause, you should at least spend it.
Councillor Young?
Thank you, Mayor Shankar. I also enjoyed the parade very much. Love to see the businesses at the window decorating contest and all of the participation, and that's going on until December the 4th. They look great. You can vote online for your favorite window display. Today we celebrated 3 anniversaries for Cozy Closet, Play It Star, and CSE Consulting. The RFP for the rebranding closed on the 15th, and I guess Dana advises we had 32 applicants, so that's great. Keep in mind the Riverwalk Wonderland is happening again this year, the weekend of December the 6th and 7th. There's going to be reindeer, petting zoo, wagon rides, and more. The patio at the base of Center Street is started next week. The wayfinding signage, there's some of that going to be installed in the next week. There's an ECDEV summit this Friday that our economic development staff will be attending, and that's it for me. Thank you.
Thank you. Deputy Mayor Byrne?
Thank you, Mayor Shankar. My voice is gonna be a little bit off tonight because I'm suffering from a cold, but anyways, I wanted to get back to council, Shakespeare's Masquerade. Big event. We made almost $22,000.
Awesome.
Yeah, it's very, very good and very well supported. And I was afraid this year. I had the honor and the privilege of being a judge. So it was Ray Young, Terry, Lynn Beach, and myself were judges. And I was trying to get people to bribe us with candy. Give us more candy, we'll judge you better. But no, it was spectacular. And our town staff and some of our councillors were dressed up and participated in different ways. And the winners, the industrial winner group was Prismium. They did a spectacular big float. Our business category was MTJB. They were super cute, all dancing and singing. And then our youth group was our South Grenville Minor Hockey. They had a pile of players participating on their float and walking and stuff. But the fire department always goes above and beyond with our Santa Claus parade. And it's months and months of organizing this big event. And Ken and I were talking, and the last time he saw the Santa Claus parade that big is when he was on the fire department. And that was a few years ago, 10, 12 years ago. It was in the fire department. So anyway, spectacular event, and really want to say really kudos to Dana for the really cool glasses that were out. It's too bad we didn't have a set tonight, but the glasses that were handed out, I don't know if anybody had an opportunity, but when you look through the glasses, they were 3D, and you looked up to a light and you saw a snowman, and the next one you saw a reindeer, and the next one you saw an elf. So it was, I had an opportunity of walking down the street and handing out these glasses and saying, if you guys want to experience the magic of Christmas, look through these glasses.
Cool.
And it was in awe. So that was a really nice added event to our parade. So thank you to our town staff for making that special too. Thank you.
Well, excuse me, will we have those glasses for the December 6th? Will there be an
That is a
October?
wonderful suggestion.
For the budget.
We may have to accommodate that, as they were a huge hit.
Huge.
Magic of the budget.
Yeah.
And also along that line, I don't know, Mary, if you know these numbers, but I ran into Chief Norton today and he said they thought there was 10,000 people.
Yes.
You know, for a town of 4,200, that's a lot of people. So that's just fantastic. And,
Yeah.
you know, other people talked about how it was an hour and a half long, you know, and I've seen us being in and out of there in 30 minutes sometimes. So
Yeah.
fantastic. The weather probably plays a good factor and
Yeah.
so many businesses were doing hot chocolate and hot dogs and
Yeah.
they're just amazing. So.
I think it really brought the community together and everybody was, like you said, Mayor Shankar, about the businesses participating and advertising, you know, we're having hot dogs and hot chocolate and come on in and see us. And, you know, that's really great to see. Everybody was excited and involved and made that just the start of our holiday season even more special.
It's great. Thank you. Councillor Campbell?
I had the honor and privilege of being Frosty the Snowman. And, but what I was amazed at, because I've lived on King Street forever, so we always watched the parade on King Street, but the amount of people 3 deep on Edward Street, I had never seen.
Yeah.
So that's where Frosty was wowing the crowd. Try not to puncture himself on tree branches as they went under them, but that was a blast. That was really, really fun, and it is magical for kids. It's fun. I attended a fire administration meeting on November 5th. They obviously do a lot of training, but they're putting training sessions on hold for November and December, having a little break. They're going to start up again in January. They've done fire drills in all the schools, so that's been accomplished. They did their evacuation drills for the Mayfield and Wellington House. The trucks have all been inspected and approved by MTO. And it's getting closer to when we get that new truck. The chief, he was supposed to have gone to see it November 17th, so he gets to touch it and see it.
Touch a truck.
Touch it.
We're hoping for the next big event, right? Yeah.
And then Mayor Shankar did mention the tabletop emergency preparedness exercise, which I learned so much from just, can I say what it was?
Sure.
Okay, so it was a power outage scenario, whether power was out for 3 hours and then it extended to 5 days. And you start realizing the kind of people that you need the help from for generators and what we really use electricity for. So all of a sudden we realize the rink ice might melt, people's food might go bad because of their freezers, and how do you really come together as a community to help vulnerable people, warming centers, all this kind of stuff. So it was a real good brainstorming session. I found it very interesting.
Thank you, Councillor Campbell. Councillor Kirkby.
Through you, Mayor Shankar. I also attended the parade and, well, just to sum it up with, often duplicated, but really not replicated so well as per social media, if you're on there. But, just to see the participation amongst everybody, including our neighboring municipalities and the downtown businesses and our staff and council. Great to see a lot of smiling faces. Just a couple updates from operations. So the water tower, the new one, has been filled. Samples have been taken. Just so everybody's aware, the old tower will remain in operation until the new tower is fully operational and been tested. There will be notices on social media when that switch takes place. Paving, some big paving has been done since our last council. Probably the most popular one was the Prescott Center Drive, which, it was never going to be good. Let's put it that way. The one thing that I will share is, that all the emergency staff knew of a route to access the area if needed.
Obviously, that's not shared publicly because that may become a road, which we don't want. But, you know, there was a short window to get it done. Council here supported it. I know it caused some headaches, but the end result is going to be great. It's going to be a safer area for pedestrians and traffic. And we're done pretty much with it. So
Weather plays a factor too, right?
weather, definitely that was the driving point, right? Is we were getting to that point where the plants are closing down for the season and we wanted to get it done using the money we had this year. Just to touch on a couple other, King Street West was done, boundary over from Churchill to the tracks. And then the waterfront base or the trail connecting to George Street was completed. And as far as that, the crew is collecting still some yard bags and stuff that are left out, and street sweeping is pretty much wrapped up and things look great. So they mulched all the leaves in some of the parks, which is a good thing, just to keep the tick population down a bit. So that's it. Thank you.
Thank you, Councillor Kirkby. I know that there was a lot of comments about the paving, and, you know, one of the comments that was quite frequent was, you know, why wouldn't they do it at night? You know, when it's not affecting me, which is such a common theme, but they didn't do it at night because it's colder at night and the asphalt has to be spread. So that was the reason for that. Thank you. All right, thanks everyone. Good updates. All right, we're going to move on to our next section, which is we're going to have 3 staff reports. The first one is staff report 90-2024, community room usage request follow-up update. So the motion is that council approve the regular usage of the community rooms at Town Hall at a reduced rental rate for senior support services, CPHC, in an effort to strengthen community health, safety, and well-being as outlined in the strategic plan. Can I get a mover and seconder for discussion? Councillor Kirkby, Councillor Young, thank you. And I think Matthew is going to speak to this.
Thank you very much, Mr. Mayor. So we went back and reached out to the organizations that we had talked about previously at the most recent council meeting. CPHC was able to provide some additional details in terms of why they're looking to change locations, and they are actively looking to change locations. So that's certainly one of the questions that was answered. Another was what would they be leaving, and they would like to bring in 2 essentially lazy boy chairs for the adult day program participants, that if they wish to kind of take a rest, that sort of thing throughout the day, that they'd be able to do so. Or if it's not allowed, then certainly they can run the program without it. It's just an added perk for some of the participants if they get tired in the afternoon and that sort of thing. The alternative is if we are allowing the chairs to be there, that we could screen them in some way with just a kind of movable screen to be able to make it nice for when we're using the room for other items. And I think those were kind of some of the major questions around CPHC. From a staff perspective, we do feel that it fits in well with the second floor and its purpose, and how it could function to help support aging in the community and those initiatives that obviously were part of the strategic plan. From the MTJB perspective, we didn't hear back from them, so haven't included their request moving forward. And then the third one was the early on program, and they've identified that at this point they're going to focus resources elsewhere, and so there will not be proceeding with running the program at this time in Prescott. So really the question comes down to just CPHC at this point, and I'm more than happy to answer any questions there might be. Thank you.
Thank you, Mr. Armstrong. Councillor McConnell?
Thank you, Mayor Shankar. The frequency of use, it says Tuesdays and Thursdays from 8 a.m. until 3:30. This building doesn't open till 8:30 in the morning, not 8 o'clock. And if they're operating from 8 a.m., I presume there's going to be people being dropped off and brought in before 8 a.m. if the program starts at 8 a.m. How do we intend to work around that? Mr. Armstrong.
So if I may, through you, Mr. Mayor, so the staff arrives at 8 a.m. We have no issue with issuing them a key fob to be able to get inside the building. Their participants don't actually arrive until 9 a.m. So building opens at 8:30. Participants arrive for 9 a.m. and then the program ends at 3 p.m. for the participants, and then they have a half-hour cleanup for staff. So no concerns from that perspective of the building needing to be open to the public and the participants before 8:30.
Very good. I do have a couple.
Follow-up?
One suggestion, pardon me. There's a large closet in the Ruth Evanson room. I don't know what the size of a lazy boy chair is. I sold them for years. I should. I don't know whether they would fit in the closet or not, but that could be a possible solution to that. There are things that you can get to put underneath the chairs that allow them to slide on floors quite easily. So that might work there. I did speak to somebody from their current location that owns that facility. And what I see here is not exactly what I hear from the other side of the coin, so to speak. And it's always nice to hear both sides of the story when you're making up your mind on something. What it says here, they're not able to continue in their current facility, accessibility concerns. Apparently what they required was I'm told, a railing to go from the sidewalk at the street to the actual church. There is a slope there. It's not a great slope, but I would say it's probably less of a slope than we have in front of our building from our parking lot. But the question is, are they going to require a railing to be put in here as well? That's something we should know. Deals with a lack of maintenance on the pathways, the entrances in the winter months. Well, they indicated that maybe one time in 10 that would happen very early in the morning if they had an overnight snow, but most of the time that was cleared and salted. I walk by here every day and I see where the sidewalk here is not always clear first thing in the morning. Is that going to be a problem here? The last thing they mentioned is an inadequate heating. They've had some heating problems down there which have been addressed and have been repaired, so they no longer are a situation. So what we read here is it's a horrible place. If you see the other side of the coin, they've done everything they can and are doing everything they can to accommodate these people. But it seems like they are not happy there. So the question is, if they're not happy there, they have to go somewhere. Is this where we want them to go? And if they do go here, can we make them happy? Thank you.
Thank you.
I just,
Councillor Ma.
Matthew, we discussed, I think, about a time period also for their, if we did go with this CPHC, were we going to do it like a year, or we were going to do for 6 months, or did we ever address that with them?
Certainly they're aware that yeah, we couldn't set any time limit. One of the things that I would suggest is doing it until March 31st, and we issued the community grant applications today. So if they fill that out, requesting the continuation of a reduced rate, then certainly that would be part of the community grant program considerations. And then we would, I'd certainly hope we would have a decision by beginning of March, so that we can, if the things are working out, then continue that if council so deems it.
Thank you.
Any other questions? Kirkby?
Not so much a question, but more of a statement through you, Mayor Shanker. A railing actually would be nice from our parking lot up our slope for people that do access our building and can't use the stairs. That's not a bad idea, to be honest with you. One that would have my support. I don't know if anybody else watched the video that was in the link from the CHPC group. But I mean, the activities look good. When I read it and I saw baseball and volleyball, I was like, you know, they're gonna play that in the Ruth Evans room. But speaking to Matthew and stuff, it's a modified version. The drumming is a modified version. And I've actually found quite a few people that use their services. And it sounds like it's a very well-received program in our community. So I would be in favor of moving this motion along.
Okay. Any further discussion? Councilor McConnell?
Thank you, Mayor Shanker. Assuming this goes ahead and it looks like it's going to, could we require from them, based on the concerns that they had with their, I was gonna say their previous location, their current location, could we require from them, say like a monthly report on any comments, complaints, difficulties that they are having? So that as we go along, we can see if there's something we can do about it, rather than at the end of March, taking a look at this before their term expires and saying, well, maybe we could have done this, maybe we couldn't have done that. I think the better communication that we have with this group, the better for all concerned. So I would suggest that as part of the conditions.
Communication.
I can just speak to that.
Yes, please.
So we certainly have that open line of communication with all of our people that run facilities. And so certainly anything that's brought forward, we either deal with it to see if we can deal with it from a internal staff perspective, or if it requires some budget allocation, and bringing that forward to council. So certainly that's part of our ongoing process, and we, I think, all can agree that we'd like to see this work for the betterment of elderly and people staying in their homes in the town of Prescott.
Great. And Mr. Armstrong, will you add the March 31st date on there?
Certainly we can do that. That's not a problem.
Okay. In that case, then I'm gonna call the question. All in favor? Carried. Thank you. Okay, next on my list is staff report 91-2024, the 2025 key infrastructure projects review. This is for information only, so I don't need a mover and seconder. And I do have maybe Mr. Mock gonna discuss this, or
Sure.
if you're ready, floor is yours.
Thank you, Mayor Shanker. Yes, there's a few large ticket items for next year to certainly be aware of. First one is the approved project at the Seymour Recreation Complex. So work will actually be starting very soon. We have a pre-construction meeting with the contractor that was awarded the work. So they're going to start stripping topsoil here this fall, probably by the end of the month. And doing a few things that they can get done this year. But really the big work will be happening in the springtime. So that's going to include soccer fields, tennis courts, pickleball courts, playground, the multi-use court, skate park pad, and a fitness loop. So certainly one that we want to get over the finish line as quickly as possible next year. And so in the spirit of that, we're having the contractor start here this fall. One of the items coming out of our contract with Ontario Clean Water Association, looking at our water treatment plant, there's a filter upgrade of $450,000. So this is related to a backwashing procedure. Further, we have flood protection improvements at the water treatment plant as well. There's a tender that's ready to be released. The estimated cost is $390,000. But of course, once tender results are back, we can speak to that with a lot more clarity. As we start to look at the planned projects for 2025, there's an East Street reconstruction. The total estimated price is between 1.4 million and 2.1 million. So East Street from Dibble and James to King is currently the top priority. Provisionally, so it's East Street from Dibble to King, and provisionally work will be included from James to Dibble. The reason being, we don't know what the prices are gonna look like that we get back from the contractor yet. And so we're including some additional blocks, just depending on what pricing is at. If for whatever, don't expect that the prices are gonna come back particularly low, but in the event that they do, we have some flexibility in terms of revising the scope of work to fit our needs. We have continuation of the marina dock replacement, an estimated $250,000. These are the improvements that have been going on since 2022. 3 of the old sections of dock remain. So we have Kehoe Construction will be completing an evaluation of the 3 docks remaining to give a recommendation about what to move forward with next. So there's D dock is 175 feet. B dock and C dock are considerably shorter, so the intention is to combine B and C, although we're withholding which one to recommend, whether it's B and C combined or D, until we have that recommendation back from Kehoe.
Good. Thank you. Questions, Mr. Counselor?
Thank you, Mayor Schenker. You have the answer to this. I'm really impressed. I wouldn't expect you to, not having been here, but perhaps Matthew, if he's still with us, can answer it. The current flow, if memory serves me correctly, is down East Street. This is wastewater, I believe, is down East Street and then west on the recently reconstructed Henry, down Edward to King, and then east on King, if you can believe it. The new connection between Henry Street and King, does that mean that it's going to go straight down, or is it going to continue on that loop?
Unfortunately,
No.
That's not happening. Oh, see, Matthew, are you able to answer that question?
So it's a good question. Ultimately, that decision hasn't been made. The biggest problem with East Street is that the whole thing is rock. So to continue that connection, both from a water and sewer perspective, between when it goes past Henry and then connecting it on down to King, will really depend on the amount of rock that would need to be removed, and we'll defer that decision to the engineers. And in consultation with the director of operations. So really it comes down to that in terms of cost versus whether it would be efficient to make that change or not. But rock is very expensive to ram hoe out, and so that's certainly something that we'll have to consider.
Okay.
Yeah, thank you. I know when we did Henry Street, they actually broke the machine on more than one occasion, hammering out rock. It was like 1 foot deep.
Yeah, it was awful.
But if you gotta dig a hole, you gotta dig a hole.
Thank you, Councilor Kirkland.
Through you, Mayor Shankar, and again, this might need to be answered by Matthew, no offense, no. Matthew, what is the age of the infrastructure underneath James Street, or East Street, sorry, is it?
So
Go ahead.
between Dibble and King Street, it's in excess of 100 years old, in particular the water main. And then we believe the sewer to be of approximately the same age. So when Henry had the issue in 2017, I believe it was, that it was in excess of 100 years at that point. When they connected to East Street, the water main and sanitary are very delicate, we'll put it that way. Not as in bad condition as it was on Henry, but certainly was showing and well past its useful life. So I believe above Dibble Street going to James that it might be a little bit newer. but south of Dibble Street, we're talking in excess of 100 years.
Thank you. I noticed, I did a drive, one of my community drives, and I noticed that James Street surface is just as rough, like from, when I say that James, I'm talking East Street from James down. It's the lower half of that section that seems to be really rough all the way down to King Street. So I don't know if the whole, like if the infrastructure there is a little newer. To me, it just looked like half of that section between Dibble and James needed to be reworked. I don't know if that would make sense to do it that way, but it seemed like there was maybe some newer paving midway up that street.
Definitely, that's something that we made a decision to do about 4 years ago. There was some massive craters in that section of East Street between James and Dibble. And so we took the opportunity to actually just put a layer on top to remove the craters, because it's not something that we could cold patch anymore. And so we used part of the repaving budget to help that, so that we weren't damaging vehicles and plow trucks and things like that.
And just one more, sorry, Matthew, and I know I sent you a list of questions, but I forgot a couple that I wrote down. When we talk about the work down at the waterfront on the break wall in front of the water treatment plant, the sidewalk will be reconstructed, and the new seawall will be a meter higher than it currently is. Does that mean the sidewalk, when you're on the sidewalk, you'll have like a half a meter of stone, or will the sidewalk kind of be brought up to that surface, I guess? Do you get what I'm saying?
Yep. So the sidewalk will sit lower than the stone that will sit on top of the seawall. So it's basically, the concept is that you build up with stone and large armor stones, that sort of thing, that can cover the seawall, so that when you have wave action, it's not an issue. They are putting in drains in the seawall itself, so that if water gets in there, it drains back out. And then there would be a sidewalk to the north of that that's not dissimilar to the height it is today.
Okay, thank you.
No, Councillor Long.
So I guess Matthew's probably going to have to answer this too. Would it be unreasonable to think that when Kehoe has his evaluation done of the remaining docks, would it be realistic to think that we could have that done like by the end of this year or early next year when the water is so low? Would it be more economical for him to work? Or would it be just too long of a process to get him to, or whoever to do if we put it out for tender?
So in terms of the evaluation, or in terms of the dock building?
The dock building.
So they like to bring the dock building because they construct it at their facility, and then they float it down the river.
Right.
So their evaluation, it should be done this week or next, and we'll bring that back to the next council meeting for approval on which dock to actually replace next year. But their preference is to build throughout the winter and then deliver in first thing in the spring.
Okay, thank you.
Thank you. I was just gonna chip in on something that Justin mentioned. What some of our new members of council might not be aware of is that over several years, we had our sewers cameraed. So we know what the situation is of the various sewers. So staff would be well aware of what the situation is with the sewers between Dibble and James, and that would be a determination of whether to do the whole thing or not.
Worst to first, right? We're doing the worst one.
Absolutely.
Yeah.
And the other thing that, if I may, when we're talking about a sidewalk lower than the actual rock, if you look at the sidewalk at the west end of the marina where it abuts the break wall is considerably higher than rock there than the sidewalk. And there's been no damage on that sidewalk because of the breaking action of that rock to the waves. So it's certainly doable and workable and usable.
Great. Oh, that's good. Thank you, Mr. Locke. Good job on your first one. I just kind of drew it up on you there. Threw it up on you. Okay, next staff report is 92-2024 pop-ups cottage purchase. The motion is that council approve the purchase of one additional pop-up cottage sized 10 by 16 feet utilizing My Main Street funding in the amount of $9,500. Our economic development leader, Dana Valentine, will speak to this. Oh, I need a mover and seconder. Okay. Councillor Burton, Councillor Kirkby, Dana, the floor is yours.
Thank you, Mayor Shankar, through you to council. So I'm sure at this point, you're all very familiar with our pop-ups operation, so I won't take you through a whole lot of the background analysis piece, but suffice to say, as you're also aware, we've received My Main Street funding in the amount of $150,000 for a number of placemaking initiatives, one of which was pop-up enhancements. And as part of that enhancement, we are proposing to purchase one additional shed for the activation. So that would bring us to a total of 10 sheds, not including our brew, which the operator provided themselves, and of course the 2 food truck operations that we have there now. The shed that we're proposing to purchase would be 10 by 16 in size, located between our brew and the blue shed on the south side. The purpose of that location is to accommodate a new non-motorized watercraft rental operator, something we've been actively trying to recruit for a number of years now. We were very close to having an operator secured for the 2024 season. Unfortunately, their personal situation changed and they had to unfortunately back out at the last minute. We have been approached by a new operator and we do have, they are in a position to sign the agreement as soon as we have council approval to purchase the shed. It is a very different scenario this year. They've secured their insurance. I am fully confident that they are prepared to move forward. They're very excited about the opportunity. And that's why we're proposing to utilize the My Main Street funding that's been received to purchase this shed. As I mentioned, it would be 10 by 16 in size. We currently have a 10 by 16 shed that was purchased for that former operator. And that shed was used by a multi-vendor artisan cooperative this year. Very successful. They intend to return next year and just continue to grow that operation and, hopefully support some new entrepreneurs coming online as well. And it's been a really good operation for this vendor because they're now looking at the potential of a permanent brick and mortar operation in 2026 and beyond. So that's an exciting development for us because the pop-ups is really, realizing what it was truly intended to be, which is a business incubator to hopefully result in new businesses coming to the downtown and uptown. So that's what we have before you tonight. Happy to answer any questions. Just included a bit of additional background information there that the under the financial, just so you're aware, comparing apples to oranges, the 10 by 10 sheds we're currently purchasing for $6,500 each. This shed is $9,500. Again, significantly larger and will support the proposed operation. Whereas the existing 10 by 10 sheds just aren't large enough to accommodate the boats that they're looking at.
Boats and bicycles, right?
No, so their focus here is strictly on boats. If there is bicycles still in the report, it is a typo because the original operator was intending on renting bikes. They are going to explore the bicycle rentals once they see how this season goes, but they're very open to other opportunities.
Great. Thank you, Ms. Valentine. Sorry, I had Councillor Deputy Mayor Burton and then Councillor Kirkby. Then
Mayor Shankar. Dana, so these are just watercrafts, like, are you talking like kayaks and
Canoes, and stand-up
paddleboards?
and stuff?
Yeah.
So you're planning on putting a shed right beside our brew. How are they going to get the kayaks? Or maybe the kayaks are gonna be behind them?
Precisely.
Somewhere?
Precisely, and that's why we selected that location specifically because it's in very close proximity to the marina and the dock that's actually ideal for them to launch their boats from. And it's pretty much level ground between the shed and the actual dock access. And what they're looking at doing is not only renting to just privately, so, you know, private individuals who want to come along and rent a kayak or canoe for a few hours, they're also going to be offering classes. And they really liked the opportunity of that location, having access to the dock for more of a group function. And again, are very excited about packaging as well with some of the existing vendors.
That's good. I think that's a great location. And I was just concerned how they were going to bring the kayaks around Arbru and if there's a band there and stuff, but if the kayaks and stuff are behind, that's perfect. Thank you.
Thank you. Councillor Kirkby?
Through you, Mayor Shankar. Dana, is the launch site inside the marina?
It is, yes. And as part of this operation, we are proposing the current launch be relocated from the west side to the east side. Where it is on the west side of the marina, it really isn't in an ideal location because it actually puts boaters in a situation where they're out in the middle of the channel, potentially encountering motorized vessels coming in, which could potentially be problematic. They simply can't maneuver as fast as motorized vessels. So putting them on the east end would actually provide them with a safer shelter area and keep them along the shoreline all the way out into the river so they never have to cross the channel.
So you're talking about moving the current launch location. Where's the current location?
At the far west end of the marina.
Right, okay, sorry.
Yeah.
I thought you meant down.
No, still within the marina, absolutely.
I mean, I'm in full support of you, the pop-ups and the shed. I do have some concerns of these people, depending on how many are going out, coming out of the marina while boats coming in and stuff like that. It seems at times it can be tight in there. I mean, I guess I wonder if you've explored other locations, i.e. down at Kelly's Beach. I know you want to stay within the pop-ups, but you know, there's a big crowd down there. You've got a beach to launch from. Prescott Place where you have, you know, stairs and access. You have that cement stair. I worry about the amount of traffic and people on kayaks in around the boats and the possibility of the marina people, the people that are renting to be there complaining. I mean, I guess we currently already have a kayak launch there, but we're not running a business out of there. You know, we're not operating a rental business out of that marina. And then, I mean, I have a bit of concern there just on a safety point. My other that I was gonna ask was, have you considered maybe a garage door, or would that take away from the theme? You know what I mean? Currently, the design looks like a swing door. I don't know if you've thought about a garage door that might be easier for the renter to come in and out with the kayaks. But yeah, I mean, I'm in support of it. I just want to flag that there's a little bit of safety concern on my point from having all these people in the marina who are presumably going to be some amateurs, right? And I don't know if anybody's been on a stand-up paddleboard, but it's not like you just step on it and go. You know, it's you're going to see some falls inside that marina. So just throwing that out there, and I'll let you answer.
Yeah, happy to address that. So we certainly considered that, looked at some other locations as well, really looked at the entirety of the waterfront. And given it is a private operation, in the past, council has, you know, really endorsed that location as being the location where we're going to entertain private operators. I know in the past we'd had private operators running out adjacent to the marina, selling, I believe, having a hot dog stand. And there was a previous, I believe it was a previous council had passed a motion to essentially disallow that from happening in public parks on municipal property. So the pop-ups has become that focus of those for-profit operations if the municipality is going to entertain them. Happy to look at other options. It was just something that we didn't think was really viable. And from a management perspective, it is, you know, from a staffing standpoint, certainly easier to manage. And for these operators, you know, their focus was really one of the appeals was having the operation of the pop-up. You know, that is it's a built-in driver for traffic, for attracting people into the community. And they felt that that would really go well with their operation. The existence of our group was another appealing piece to them. They felt there could be some partnerships, packaging options. And if I can reassure council, this is not something that they're going to be operating 7 days a week where there are constantly classes going out. These are two individuals with full-time jobs. The pop-ups is a Friday through Sunday operation, so it would be limited to those times primarily. We also consulted the Coast Guard to just take a look at, what sort of safety concerns are out there and when it comes to the marina, other boating traffic, shipping traffic as well. And they've provided us with full reassurance that there are no concerns from their standpoint or permit requirements. They provided us with some great guidance that we've passed on to the operators to really help set them up for success and avoid any of those potential safety concerns that could arise, and they will be fully insured.
Let me ask you this then.
Mhm.
If the town was to provide a dock and put it down by the beach, wouldn't that be a better solution because of the more people that are there to use the water? I don't, for me, you've got probably anywhere from 100 to 200 people down at that waterfront that are there for water sports a day. I honestly can't see how our brew and a kayaking business are gonna work a deal, have a beer and go kayaking on the river.
Well, it'll be a paddle and sip versus a sit and paddle.
I know, but I mean, it's just, to me, it just doesn't feel like the right location, but happy to entertain it and see how it turns out.
And I think we looked at it as quite the opposite in that being a public park, it really needs to be public and have everything be fully accessible versus getting into having a paid or for-profit operation down there.
I mean, I see a ton of, you go all over, there's rentals. I mean, there's amendments that could be made to allow something that fits within the area, right? To me, something like that, that's non-motorized fits in that area.
One of the other pieces to that, if I can, was the access from a parking portaging aspect. These are boats that are unwieldy. People have to, if they're not renting, a lot of people will still use the dock to launch their own boats from. So it is a much more accessible location, especially for the operators if they're trying to bring boats in and out as well. Parking is an issue at Centennial Park, where we would be proposing, I think, putting any sort of launch would be more in the vicinity of Kelly's Beach, which is not in close proximity to the designated parking for that park. So they would be forced to be backing their trailer up into very, again, heavy populated areas, could present additional safety concerns when they're moving equipment in and out on a daily basis.
Oh, so they're not going to leave the kayaks in the shed?
Some would, but they would be bringing some in and out as well, depending on what the needs are for different classes throughout the week. They may have, they'll be selling as well, so they'll always be bringing new inventory in.
It just seems like, to me, like at Blockhouse and Brockville, you don't see any kayak rentals. They're actually down at the, in between the beach and the Brockville Club, I guess is what it's called. That's where the kayak rentals, St. Lawrence Park, thank you. That's where it goes. Anyways, good enough.
Thank you.
Leave it at that.
Councillor Lockett, then Councillor.
So I have a different approach on it, and I think I'm not against kayaking or paddleboarding or anything, but I think we need to really be careful because if somebody wants to start a business to get a municipality or somebody to pay $9,500 for a building for you to do it and pay $300 a month for 3 months or whatever it is.
Okay, if I can, that's
Yeah.
not what they pay.
They don't pay.
No,
$300
there's a different.
for a bigger
price, yeah.
So, but still, I think we have to be really careful because at this point, anybody can come to us and say, we've got this great idea and I think we would really add to your thing. And are we going to keep buying buildings for them? If the building that we already purchased last year would work, then maybe the person that's in it could move to some other smaller area. But I think we have to be very, very careful because we're already in a bit of a conflict with some businesses in town that say we're giving too much to people just coming in and wanting to start a business and us footing the bill for the lion's share, but I think we have to be very careful.
Councillor McConnell?
Ruth is being very diplomatic here, and I'm not so inclined, as she well knows. The R brew that you mentioned has been quite controversial, and I believe that's a matter of discussion for this council, whether it should continue there or not. It is in direct conflict with businesses that are closed. And the comment that we set up a stage for free entertainment right across the parking lot from them was not very well received by other people. Aside from that, to Justin's comments, I kayak. I wouldn't even consider putting my kayak, which I own, in at the marina. I marry kayaks as well. We put them in at the town boat ramp because it's the easiest place to put them in. I can drive the car right up there, drop it on the grass, go and park the car and slide it in. And it's not the greatest boat ramp for boats because of the waves. But if you have a kayak, which is a smaller, self-propelled vehicle, you can wait until the waves from I was gonna say an ocean liner, large boat goes by until it's not affecting you. Kelly's Beach, last thing you want is people paddling in and out of there with anywhere from 20 to 30 or more heads in the water that you might run into accidentally. We did put a small dock, if you want to call it, kind of in the angle there by Kelly's Bay, but that was a crazy place to put it. I said so at the time, because to get your kayak there, you gotta haul it from way over the parking lot, which is crazy when you got the boat ramp right there. Not only that, along the front of Centennial Park and Kelly's Bay, you do have the large waves. It's not a great place to be launching kayaks, but I have paddled many times into the marina with my kayak. There's never been a problem of it. There's not that many boats coming in and out of there at the same time that you can't just wait till they go by. People are fairly polite. I mean, we don't have people pulling out of there, zooming out. No, people come in there very quiet, so no wait type of thing. So putting kayaks in, if you're gonna put the building anywhere where Dana is suggesting it goes, I think is the place it should go. And changing that launching dock over to the other end only makes sense. You had a very good point though with the doors. Now, with the size of those buildings, an overhead door really doesn't make much sense in my opinion, because the garage door, you have the track, which I think is going to wind up at head height in there. But having two kayaks and having stored them in my garage, I realize how much space these things take up. And twisting those and turning those to get them out of the two opening doors on the front, I think might not be the greatest idea. And perhaps you should speak to these people that want to rent it and see if having two opening doors on the end, if that's structurally possible, would make more sense. Then you could go in with the small dimension, which is just the link, sideways, and take it in and out there. Storage of kayaks is not a problem at the marina, because if there isn't enough space around this building or behind this building, we currently have a rack on the flat beside our marina building that we rent to people to put their kayaks there. And I don't think it would be a big problem if you find out how many kayaks these people are going to have, to perhaps include another rack in your grant money that you're going to use, that we can actually rent to them to place some kayaks there. So the long and the short of it, where you're suggesting it goes, I'm fully in favor of. I was hot on this when you suggested it a year ago, and I was really disappointed that it didn't come to fruition, because I told a lot of people about it. I think it's where it's going is where it should go. Boat traffic is not going to be a problem with it in my experience. My only comments on the whole thing really have nothing to do with the kayaks, but it's with the our brew, and I'm not at all convinced that our brew should be there. I was under the impression when we approved our brew, and I realized this is not the subject for here, it's for another time. And can we actually put that on for discussion shortly? Because I think those people should know shortly whether they're coming back next year or not. We put that on for one of the next 2 meetings if it's not too long.
We can probably, we'll have to see where we would put that to have that discussion. Just one sec.
If I can, I can just quickly speak to the door, and I apologize, I forgot to address that part of your question, Councillor Kirkby. There will be 3 doors. There will be a double door on the side, and just as Councillor McConnell proposed, there will be an additional door on the end. So that will be the door that will be utilized to take the boats in and out, so there will be no twisting or maneuvering required. We did the same, the existing 10 by 10 shed, you can take a look at that. It's 10 by 16. It's designed in the same way. The double door is on the side and then one single door on the end.
Okay. I have Councillor Campbell, then I have Councillor Young.
All right. I agree with Councillor Lockett that we did approve getting that side of shed for the kayaks last year. And I know the person that's currently situated in that bigger shed is appreciative of it and things are going well, but I think the whole point was when they do get too big and successful, that they do move downtown. So I'm proposing that we let the kayaks go into the bigger shed that we approved for last year. And my other question was, if someone's on a paddleboard and they fall and crack their head in the marina on a dock, who is responsible to save them? Is it our marina staff?
To save them.
If they're unconscious in the water, you don't understand how getting amateurs into these very tippy things is going to. Anyway, I just didn't want to put additional responsibility onto our marina staff. But maybe you just call 911 and.
I'm certainly happy to address both of those. So of course, in God forbid, the case of an accident, the operator will always be on site and is ultimately responsible for all of their patrons. If someone were to injure themselves, it would be their prerogative to contact emergency services from there, as well as inform marina staff, because it is happening in their facility. So I think it's important that communication is happening, but the ultimate responsibility would be on the operator, certainly. And just going back to your earlier comment about the operator in the shed, I do just want to clarify that operator was had a partnership with one other individual this year, and that individual has since pulled out. So this is not a situation where the vendor is carrying on their rental solely. They're actually recruiting 4 to 6 additional vendors in. So this would truly be a multi-vendor artisan cooperative, which is now going to provide a potential business incubator for 6 new businesses versus 1. So that's why we're recommending that shed be retained for that cooperative next year, versus if it was just to be for a lone vendor, we would never be recommending that.
Thank you.
Thank you. Councillor Young?
Thank you, Mayor Shankar. To me, for tourism, for our tourism strategy, people are looking for experiences. And this is another experience. And we're using the river that we're so lucky to have. And the other shed that Dana was talking about, it's really well used. There's an experience there too. So, and I don't think this new experience is competing with any other business at this time. And the money that we'd be spending from the My Main Street, that money isn't going to replace another idea that you had in mind. Okay.
No, absolutely not. This was the original intent for that funding.
Yeah.
It was a multitude of enhancements, everything from, well, a lot of the work that you've seen happen there over the past 4 months, as well as the purchase of an additional kiosk
And Dana, when do you have to spend that money by?
December 31st.
So that's that's a big point that you make there, that this is all being funded by government funding that we got. So we're beating this to death on money that we've been given. Yes, sir.
Just to go back to Mary's point, so 100% of the liability is on the vendor, not on the town. So that they slip and fall on our docks.
They have to have their own insurance covering their operation and any sort of liability that comes from that. They also have to carry third-party liability that names the town.
And that being said, would the town be performing inspections on the launch that we are renting or supplying the unit?
So absolutely, that is our property and would ultimately be our responsibility to maintain and ensure that it is functional for the purpose of public and private use for the operator.
Thank you.
Follow up?
Yeah, something I missed entirely, didn't even consider. I haven't been thinking about paddle boards here. I've been thinking about kayaks because I'm a kayaker, but any place that I've been on holidays where they've been renting paddle board off of Sand Beach. I know at our cottage in PEI, we've got a lot of paddle boarders, but it's very shallow there and it's always off the sand beach. If we have people renting, anybody that's a paddleboarder is probably going to have a paddleboard that knows what they're doing. And I'm wondering if these folks are renting paddleboards to folks who would like to try it, where it's being put in. You can't really put it in off the kayak rack, I wouldn't think. You're gonna have to step off the dock onto it. And that dock has boats tied up to it all along.
If I may, Councillor McConnell, this will be up to the vendor to figure out, not for us to figure out. If this is their plan, or they decide maybe kayaks work better than paddle boards, they'll remove the paddle boards and just use kayaks. But this is not something for us to try and figure out for them. If they're willing to do this and they'll have the insurance for it, let's let them do it and let's not try and micromanage them.
We want to give them the maximum possibility of success, so they will be back next year. And I think renting paddle boards is a really good thing for that marina. What I'm going to make is a suggestion. The original marina design allowed for a boat at the end of the dock. We're talking about putting that kayak ramp on.
I don't know.
Yeah. Is there any possibility in this grant of buying a small floating dock like the one we have at Centennial Park? That they could launch a paddleboard off.
Or maybe the vendor can do that.
In any case, I think.
We'll find out through the summer. We'll find out.
And we can certainly investigate to confirm that the current setup will work for any type of boat. And if there are additional modifications, we would absolutely look into that for sure.
Great.
I'm sorry.
Can we move on, no?
Well, you know what, but I know you want to get it through. In my opinion.
We're spending half an hour on $9,500 that the government's giving us to put there for a new business.
Until somebody falls off a paddleboard.
But they have
that's never
insurance.
gonna- It doesn't matter if they fall off and they're on our equipment or they're on another boat that's in that marina. You damage that boat in the marina.
With a
Have you been
paddleboard?
on a paddleboard?
With a paddleboard?
Have you been on a paddleboard?
No, sir, I haven't.
Right, so I can tell you that I've been on lots of paddle boards and I've watched a lot of people. I lived on the river for a long time. We had a paddleboard and lots of people came over and used the paddleboard in shallow water. Because the first time anybody steps on a paddleboard, they're probably gonna fall off 9 or 10 times. Which means they're gonna be falling off in the marina that's full of weeds or potentially against rocks or against boats or against docks. And you can say that the vendor has their own insurance.
Right.
But the people that sue always go after the biggest pot of money. They don't go after the business that only has
And you're right there.
$1 million.
You are right there. So then we should have no businesses or no one allowed near the marina.
I'm just saying maybe the paddleboard might not be the appropriate item to have in the marina, in my opinion.
Okay.
Kayaks,
Great.
canoes, right? But I'll just say it, then there, it's on the record, I guess, you're saying.
Great.
Fair enough.
Thank you. Anyone else?
All in favor?
Oh, I was just gonna reread it, but it's pretty simple. All in favor? Opposed? Abstaining?
I
What do you-
called it a little too quick there.
All in
We're
favor?
all in favor of buying the building. That's what that motion is.
That's the motion.
Okay, well, I'm in favor of buying the building.
Carried.
Also.
Thank you. That's it for staff reports. There's no resolutions, no bylaws, no new business. We do have a notice of motion from Councillor McConnell, request to re-examine OPP building. Floor is yours, sir.
Thank you, Mayor Shankar. Before I read this, I'd just like to introduce it by referencing something that Councillor Kirkby over there mentioned, that he had wished he possibly had pulled out the support for Tweed at our last meeting. If that's the way he feels, then when this actually comes before council next meeting, he should not vote for this, because this does not support Tweed. Tweed's motion was to have the provincial government essentially take over paying for OPP services, and the supporting motion from the other community, which I forget what the name of it was, supported that. This does not support Tweed's motion. This is a different way to look at it. This is the way I'm looking at it, because in my experience, we're never going to get the province to do that. And if they do, we're going to suffer for it in some other manner. So I'll read this for you. Whereas in 2015, the provincial government, after much lobbying by municipalities, moved to standardized billing for non-contracted, that is 5.1 OPP locations. And whereas the standardized billing provided much needed relief to municipalities like the town of Prescott, who at the time were at the top of the existing fee structure, but at the same time resulted in increased budget pressure on those municipalities toward the bottom of the same structure. And whereas the inexorable upward creep of OPP costs during the ensuing 10 years is once again becoming an undue burden on small municipalities throughout the province, and whereas this increasing burden is limiting the funds available through taxation to address the maintenance and replacement of aging infrastructure and to manage operations in general. Therefore, it be resolved that the town of Prescott calls on the provincial government to once again re-examine the issue of OPP billing and act forthwith to reduce the impact on municipal budgets. And that a copy of this resolution be sent to the Premier of Ontario, Minister of Solicitor General, Minister of Finance, Association of Municipalities of Ontario, and all municipalities in Leeds and Grenville. So you can see I'm asking them to examine the situation and do something about it, not to take it over. And I think that would be more of a chance of success. Thank you.
Thank you.
Mover?
No, that's notice of motion.
Notice of motion. That's it? Okay. Thank you. So that will come back to the next meeting? Correct, thank you. No proclamations tonight. The questions? So we're going to move into closed session. So the motion is that the council move into closed session at 8:04 p.m. to discuss matters pertaining to closed session minutes and union contract negotiations. And then the CAO treasurer, director of administration clerk, director of operations, and deputy clerk remain in the room. Mover, please. Council Deputy Mayor Burton, Councilor Kirkby, all in favor? Great, thank you. We'll start in about